Hello and welcome to Health Reform Watch, a collaboration between Reuters and the Forum at the Harvard School of Public Health. I'm your host, David Morgan, healthcare policy correspondent for Reuters, and with me today is John McDonough, professor of public health practice at the Harvard School of Public Health and director of the Center for Public Health Leadership. Greetings, Professor. How are you today?
Fine. Nice to be here with you.
Likewise. Today we're going to discuss the nomination of Sylvia Burwell as replacement for Kathleen Sebelius as Secretary of Health and Human Services.
I look forward to carrying on the important work of ensuring that children, families, and seniors have the building blocks of healthy and productive lives, whether it's through implementing the Affordable Care Act, supporting affordable child care, or finding new frontiers.
Ms. Burwell faces 2 Senate confirmation hearings and a final confirmation vote, possibly as early as Memorial Day. And because she would be the administration point person for the Affordable Care Act, the Senate confirmation proceedings are likely to be replete with election year rhetoric, particularly from Republicans who are trying to make Obamacare their top issue in the campaign to gain control of the U.S. Senate from the Democratic Party. Now, given all of that, Professor, what kind of a reception do you think Ms. Burwell can expect from the senators when she arrives on Capitol Hill for her hearings?
Well, the first thing to remember is the coaching that any nominee gets by the administration before they show up at a confirmation hearing. Point number 1 is bite your tongue. Say as little as possible, because your goal is to get through the hearing with as little damage as possible. And the second point is to remember it's all about them. It's not about you at all. And so the senators want to show off, make statements, get noticed, and make their political points. And I think we'll see, importantly, shifts from both sides in both of these Senate confirmation hearings. Particularly, we're going to see Democrats attempt to take advantage of the recent good news around the enrollment in the Affordable Care Act and to provide new lines of argument to demonstrate that the law is working and that it's a success. And for Republicans, we're also going to see a continuation of the shift away from simply repealing Obamacare and moving toward presenting some kind of a credible alternative to it. And so how they make those arguments will be far more interesting than anything that the nominee has to say.
The nominee is currently White House Budget Director, and her background has very little in it that suggests she is experienced in health policy issues. Does she face a competency question given the fact that she would be heading one of the largest departments in the federal government?
Unless something happens between now and the hearing or at the hearing, that's not likely to be a problem. She's the director of the Office of Management and Budget. One could make an argument that that's actually a tougher job in the federal government than being Secretary of Health and Human Services. Also, there's not been a single person who came to the office of Secretary of Health and Human Services in recent history who had competence and experience in all of the areas for which they have responsibility. The key role, the key challenge for Ms. Burwell or anyone who takes that position at this point is a management challenge, making sure that things run competently and that there is an avoidance of catastrophes, particularly the kind that we saw last fall with the launch of the federal website. So to prevent those things from happening, to make sure that the department is run well and that it avoids getting in the news for negative, controversial reasons, that's the primary responsibility that she has. She was confirmed to be the head of OMB by a vote of 96-0. And as recently as this week in Politico, there are a number of Republican senators who are already saying that they think she's competent and that they are likely to vote for her unless something comes up between now and then.
We have also heard from Democratic sources that expectations are that one of her tasks, if she is to be confirmed, is to try to keep the Affordable Care Act out of new controversies, out of new negative coverage. How can she do that given all of the attention that it's getting in the election campaign?
Well, she certainly cannot stop the barrage of negative ads as long as polling indicates that that is a potent approach for Republicans who are trying to get an advantage in the fall elections. As long as that is the case, the barrage of ads will continue. What the White House hopes she can do is avoid a repeat of catastrophes like the website debacle of last fall, which became the dominant news story for nearly 2 months out of Washington, D.C., and it was all negative. And in fact, the administration is still climbing out of the hole that was created. And the recent polls show that in spite of the good news on enrollment exceeding projections, that there is still a public perception that is more negative than positive. So the goal is simply avoid something bad and don't create any self-inflicted wounds or self-inflicted damage, not just over 2014, but also over 2015 and 2016, because she is likely, if confirmed, to stay through the end of the Obama presidency into January of 2017.
What are some of the bad things that she needs to avoid?
Well, the important piece is to stay on top of implementation of the law. There are still technological challenges to be worked through. Everything around the website has not been fixed. There is concern about what will happen with the premiums that will be paid for to buy health insurance through the exchange in the second year of enrollment beginning in early 2015. So those are some of the things that are in front of us that we know she will have to address, as well as other implementation issues around the further rollout of Medicaid in the states. And then there's always the unpredicted, the unexpected that will occur. And in those cases, you can't avoid them happening at all, but you can try to manage them as well as possible so that any negative stories or any damage that is done is minimized to the greatest extent possible.
Some Democrats tell us that they believe she has a tremendous ability to build positive relationships across partisan lines. And one of the expectations for her, if she's confirmed, is that she will work both sides of the aisle to try to get agreements that can fix some of the things in the Affordable Care Act that policy experts say need to be fixed. Can you imagine what might be done in that vein given the political climate that surrounds Obamacare?
It is unlikely that much at all will happen this year, although there was a positive sign just this week when the House of Representatives, by a bipartisan vote, approved a piece of legislation that fixes a flaw in the Affordable Care Act around coverage for people living outside the United States. A very small, minor issue, but a significant number of Republicans and Democrats came together. That issue will go over to the Senate. We'll see what will happen. But increasingly, and not so much this year, but getting into 2015 and 2016, I think there's going to be a different dynamic in play, and that people in Congress are going to want to demonstrate an ability to address deficiencies in the law and find those places where they may be able to make progress.
Well, thank you, Professor. I think we're just about out of time. It's been another insightful conversation, and thanks also to our viewers for joining Health Reform Watch. I'm David Morgan. See you next time.